We have often heard and seen that different people react differently to the medications. There are multiple reasons why they do that. It may be age, gender, other medical complications, or the habits. But along with that, their genetic makeup plays a very important role. And pharmacogenomics is a science where we study a person's genetic response to different medication. When we take a drug, it undergoes a processing through series of reactions in our body. That is, a drug metabolizes in our body to give a therapeutic effect. However, certain genetic variations in our DNA can alter the way we process and respond to drugs. By studying these genetic variations, researchers can identify specific genetic markers that are associated with a drug response. Healthcare providers can analyze a person's DNA to look for these markers and predict how a person will respond to a drug. This is how typically a pharmacogenomic testing is done. For example, a patient with a specific genetic variation may require a lower dosage of a drug to get the same result as compared to someone else who doesn't have that variant. Similarly, a genetic variation may increase in some cases a risk of adverse drug reactions in a person's case. Pharmacogenomics reports are increasingly being used to personalize the medication and improve the patient outcome worldwide. If we look at Indian situation, in case of India, it is a unique opportunity on one side and challenges on the other side when we talk about pharmacogenomic testing. According to a study published in Indian Journal of Pharmacology, the incidence of adverse drug reactions in case of India ranges from 1.6% to close to 38%. And mortality because of ADRs or adverse drug reactions also ranges from 0.6 to close to 14%. ADRs or adverse drug reactions are also responsible for close to 4% of hospital admissions in case of India. Now, this brings us a substantial opportunity for us in India based on the pharmacogenomic testing. With pharmacogenomics, doctors can move away from a traditional one-size-fits-all approach towards medication to more personalized medicine. Specifically personalized medicine in case of cancer, cardiovascular diseases, psychiatry, and neurological disorders, I think can play a very important role or game-changing role in the case of India. There are a lot of opportunities on this side about how pharmacogenomics can play a role. But along with that, there are a lot of challenges too. And the biggest challenges is the lack of awareness among the healthcare professionals about the pharmacogenomics biomarkers, its applications, and its relevance in the patient care. There is a limited genetics and genomic related knowledge among doctors who practice medicine in India. And because of it, even the pharmacogenomic reporting or interpretation of it becomes a big challenge. I think that is the biggest hurdle in the implementation and success of pharmacogenomics in our country. The Indian government's push for a digital health provides a great opportunity for integration of pharmacogenomics in the routine patient care. The development of cost-effective pharmacogenomic tests and generating genetic data on a large scale are also areas of potential growth in India. By tailoring drug therapy to individuals' genetic makeup, healthcare providers and clinicians can achieve better patient outcomes, reduce the adverse drug reactions, and minimize the cost of treatment for a person. Educating and training healthcare professionals. Promoting widespread implementation of pharmacogenomics or PGX in both curative and preventive level. There is a need for increased collaboration between healthcare providers, policymakers, and researchers to harness the true benefits of pharmacogenomics.